joining me is Cathy Proll from Sensity. Welcome, Cathy.
Well, thank you for having me today.
I really do appreciate you coming in, because today we're going to create some awareness for intervenor services for Ontarians who are deafblind. So you're here on behalf, you're CEO of Sensity, and I love that name. Is that been its forever name, Sensity?
No, we were previously known way back in the day as the Canadian Deafblind and Rubella Association. At that time, we were supporting a lot of children that were born with rubella syndrome as a result of, their mothers contacting German measles. And over the years, we evolved to Sensity. Our formal name is the Deafblind and Sensory Support Network of Canada, but Sensity really captures the essence of sense.
Right. So that it also brings us along with the changeover, that idea of senses from the former name as well. It's very creative. I love that. And so we are going to talk about senses today. There are hundreds of thousands of Ontarians, and I didn't realize that was the number, who are living with deafblindness. So what are tell us about some of the concerns and the difficulties that people face, and what can be done to help them?
So there are over 200,000 Ontarians who are living with deafblindness. In particular, in the KW area, there's about 1,400. And really one of the biggest challenges that people who are experiencing deafblindness have is communication challenges. Being able to interact with the environment. With the lack of vision and hearing, it's really hard to, get information. It's really hard to, understand communication and people understanding your communication. So in order to support people who are deafblind, we have a service that's called Intervenor Services. We have a number of agencies around Ontario who do provide these services. Some of them you may be familiar with, CNIB, Deafblind Community Services. We have Deafblind Ontario Services, Canadian Helen Keller Centre, Lions McGuinness House. And so we all have a little bit of a niche of something we do a little bit differently. But we work together to bring awareness to the disability of deafblindness, but also to the role of an intervener.
Right. And you said a name in there as well that I recognize, Helen Keller. So I think that's probably the most well-known person, Helen Keller, and her resilience and overcoming those challenges that she faced with deafblindness. And I believe that we were saying earlier that maybe this was something when she was 3 years old, that she was a meningitis perhaps, and she experienced deafblindness and needed those supports as well to be able to navigate her world. And then you also mentioned it's at birth as well. Some people experience it. But what are you seeing more now? Is that sort of the same clientele, or are you seeing a different clientele now?
So there's two sort of themes that I'm seeing. Certainly people who are born deafblind are typically now a result of what's called charge syndrome. And people who are becoming deafblind later in life, it's really about people and the aging process. So I would say the leading cause of deafblindness today is actually seniors. Okay,
right. And it's because it's a perk of our society with better health care. We are living longer, but the senses don't, there's a deterioration of the senses the longer that we live sometimes.
That is correct.
Yeah, yeah. So as an example then, if someone, I guess because there's a whole range of abilities or limitations with deafblindness where someone may have some sight or they may have some hearing, what sort of practical ways can an intervener help someone with deafblindness?
So interveners are a specialized profession. Their training is quite intense, and their training can be as individual as the person they're supporting, because there are no two people who are deafblind that may have the same level of vision and hearing. So communication can be, sometimes it's ASL, sometimes it's a total communication approach, it could be two-hand manual. So interveners require a lot of training in order to be able to support people in their preferred modes of communication.
Right, right. I know that you had some awareness, was it 2 months ago? Was it in June?
Yes, yeah. Yes. So June is a Deafblind Awareness Month. The Senate proclaimed it in 2015. So it's a celebration nationally of an opportunity to really enhance the awareness activities that we do during that month.
Right, and so with the intervenor services, the supports, do they come through Sensity directly, or do you make use of the other partners that you have mostly?
So we have a wonderful partnership actually with the Ministry of Children's, Community and Social Services, and they have been very supportive of not only, you know, providing funding for these services, but we worked together, the Deafblind Network of Ontario and the ministry, in developing an application process whereby people go to the Deafblind Network of Ontario website, they begin an application process, all the agencies that provide the services are listed, so they go through a process, they go through an assessment process, and then it's determined what their level of support could be. So that's sort of the single point of access where we would send people to go if they're in need of services, or even just information about deafblindness or intervenor services.
And this is something supported by the government of Ontario. Yes.
Yes.
These services are part of.
I
was just wondering if they're like user fees, or is to be able to access these services, it's available.
No. So
Yeah.
it really is about, you know, application, equitable access to services.
Excellent. Excellent. And I was also wondering, just on a personal note, how did you get involved with Sensity and your work with deafblindness, and what drew you into this field?
So it was interesting. I had graduated from school, and I thought I wasn't sure what I wanted to do, and an opportunity became available for an intervenor position at the W. Ross Macdonald School in Brantford, and I thought, oh, I'll try this on. And I remember thinking, I can't believe they're paying me to do this job. I had so much fun, and it was such a wonderful opportunity to, you know, work with others and support that. And I got bitten by what they call the deafblind bug, and I've been in the field, you know, 40 years later. 40 years. Well, that is, oh, there you go. I'll give you flowers now. That is amazing. Thank you for just some decades of service. That is amazing. And we want to do, I think as a community, we want to do our part. So can you tell us ways that businesses or municipalities can make it easier for someone living with deafblindness to navigate in and around these spaces? I think that, you know, the communities have been doing a great job of, you know, looking at the physical barriers and, you know, looking at ramps and those types of things. So it's more the invisible things that municipalities and businesses, you know, need to focus on. So things like lighting when you go into, you know, a store. I have a wonderful story. Our resource center is located in Paris, and they were doing construction on the road in front and putting in new sidewalks. And, you know, they were familiar with the work that we did at Sensity, and so without even, you know, consulting us, they automatically put in sidewalks that were twice the size, knowing that interveners were working with people who were deafblind.
Okay, like two people.
And that's a really great example of how a municipality sort of looked at some of the invisible, you know, disabilities and how they could be addressed. Contrast is often important. You know, tactile markers are often helpful as well. So really just thinking about more than just physical challenges, but thinking about how we can compensate for the sensory component.
Exactly, give it that helping hand. Well, I'm glad to hear that we're doing our part, and of course we can always do more. How can, does Sensity have a website, or what is the best way if someone is looking for those, is seeking those services, or a loved one, they'd like to get those services for a loved one? Again,
we are one of a number of service providers, so I would direct anyone to the deafblindnetwork.com website, and they would be able to find out more information through that venue.
Excellent. Well, thank you so much for joining us today, Cathy. It was a lovely chat. I've learned so much, and all the best.
Well, thank you so much, and again, thank you for the opportunity to be here.